Paget's disease of bone, type reactive, key features. It's a progressive metabolic disturbance of bones resulting in symmetrical enlargement, as we can see here. Radiographically, it presents with cotton wool appearance. So if we look at the radiograph here, you can see something that looks like the fluffy cotton wool, and even here in the OPG. Alright, in Paget's disease, you can observe an elevated alkaline phosphatase level due to increased bone breakdown. Hats and dentures become too tight, and patients with this condition have an increased risk of developing osteosarcoma. Now, I think you're wondering, how do all these things happen in Paget's disease? Well, in Paget's disease, osteoclasts are more active than osteoblasts. This means that there is more bone absorption than normal. The osteoblasts try to keep up by making new bone, but they overreact and make excess bone that is abnormally large, deformed, and fits together haphazardly. While normal bone has a tight overlapping structure, like a well-constructed brick wall, bone afflicted by Paget's disease has an irregular mosaic pattern, as though the bricks were just dumped in place. The end result is bones that are large and dense, but weak and brittle. The bone is prone to fractures, bowing, and deformities. Now let's go back to the main features and see how we can remember them. Starting with the radiographic cotton wool appearance, we will give a nickname to Paget's. It will be Page, and as we all know, the page is white like cotton wool, right? So remember Paget's, Page. The page is similar to the cotton wool. Moving on to the next point, which is the elevated alkaline phosphatase levels. We said that hyperparathyroidism equals path, and the path leads to the elevated Alps. Now, if we look at the classic image of the Alps, we can usually see that they're covered in snow, which is white. It's almost like they're covered with pages. So remember the two things that are related to the elevated Alps. The path leads to the elevated Alps, and the elevated Alps are covered with pages. The next feature of Paget's disease is that hats and dentures become too tight because the bones of the head are becoming big. This condition is known as Lientiasis ossea, which basically means that the skull becomes similar to that of a lion. Speaking of lions, where else do we see lions? We see it in the logo of Peugeot cars. And of course, Peugeot here is the nickname for Paget's. So remember, Paget's, Peugeot, Lientiasis ossea. The final feature here is that patients with this condition have an increased risk of developing osteosarcoma. Now, as we now know, Paget's disease results in enlargement of bones, and whenever there is an enlargement of something, we would always think of the possibility of cancer, which here is osteosarcoma. So this is pretty easy to remember and relate. Now, moving on to the treatment of Paget's disease, it's mainly via bisphosphonates and calcitonin. Now, remember that the main problem in Paget's disease is the overactive osteoclasts that result in more bone absorption than normal, and the osteoblasts will come and try to make new bone, but they overreact and make excess bone. This excess bone is deformed and large and fits together haphazardly. So, as we said, the main problem is because of the osteoclasts. So we want to decrease the osteoclast activity, and bisphosphonates and calcitonin are perfect at inhibiting osteoclastic bone resorption.